How to offset declining reimbursements. We all know as clinic owners, declining reimbursements are an issue. We're seeing it here in Appleton, Wisconsin. I'm sure you're seeing it in your clinic too. It seems to be the Biden administration's agenda, especially with CMS. I'm Dr. Michael Johnson. I'm a board-certified chiropractic neurologist. I've been in private practice in Appleton, Wisconsin since 1983, so I've been around the block. And we have an integrated clinic. We have mid-levels and RNs and LPNs. Nurse practitioners do the work. And so how do you combat these declining reimbursements? The answer, TM flow. Have you heard of the TM flow? Do you know what it is? Got some other videos on it. You can take a look at them. I'll have them linked below. But what is it? It's a medical device data system integrating three technologies: the galvanic skin response, the pulse ox, and the ankle brachial indices. Who is it for? Basically, patients who have insulin resistance or diabetes or cardiovascular issues, people who smoke, might drink too much alcohol. I mean, don't you love when people tell you they only have 2 drinks a week, and it's actually 2 drinks in 30 minutes. You've had those, right? Sheesh. Yeah, so this is what the TM flow looks like. In our office, the LPN does the testing, and then the nurse practitioner goes over it with them. So, why TM flow? Let me show you first. It has a pulse ox here. You can see the blood pressure cuffs on the ankle and the arms, and then the electrodes on the bottom of the feet. And so why TM flow? Artery and autonomic nerve dysfunction or damage are the most frequent complications of diabetes, kidney disease, hepatitis, hypothyroidism, and aging. And although these symptoms may imitate each other, it's imperative to distinguish autonomic neuropathy and arterial disease because the treatments can be quite different. Don't you love my graphics? I'm just totally old school, one take, boom. But that's how you really can, and I've had doctors save their practice with this unit. How and why? Well, you're going to make, as far as a reimbursement goes, anywhere from $400 to $500 per visit. And in our office, in our clinic, we get $320 for the actual test done by the LPN. Takes her 10, 15 minutes. Sometimes 20, depends on how much she's talking to the patient, which is a good thing. And then a few days later or a week later, the nurse practitioner will come and go over it with the patient. So we get another 120 for that. On top of that, we make some recommendations for supplements. And let me show you this one. This patient yesterday, look at this, cardiometabolic score, cardiovascular and metabolic issues like diabetes, 40%, and he should be above 80%. So when a patient sees it in black and white on paper, you all know that, they really take it to heart and they're gonna make some changes. So that's how you combat it. Now in our office, peripheral artery disease, peripheral neuropathy, things like that, what we will do, we use shockwave therapy and not radial pulse waves like a Zimmer or Storz or what's another one? Gaines wave. Okay, that's all well and good if you're doing erectile dysfunction in your clinic, and that's fine. But if you really want to help lower back patients, chronic pain patients, peripheral neuropathy patients, you really need something more powerful. So we use a SanuWave profile. I'm a distributor for that also. We can talk to you about it if you're interested. And we use the Synexus Neogen system. So we have the patient walking out on the first visit. We'll do the Synexus first, then the shockwave. On the first visit, they notice a change. That's what we do. I'm not saying you have to do it. I did speak to a physician this morning and goes, yeah, I want to get into peripheral neuropathy. What do you do for it? You just give them gabapentin, Lyrica? No. Every patient walking in our door has been on those medications for years, and they're still walking in our door because they're not getting help. And as all of you know, as physicians, gabapentin and Lyrica are seizure meds. They're not pain meds. So, you want to go something different, talk to me. I'll give you my email. If you don't, that's okay. I'm not telling you what to do. It's your practice. You run it the way you see fit. But I want to see patients, and I want to change their life. And that's what we do in our office. I mean, we've had patients with 5 or 6 lower back surgeries. And I've asked them, why did you have the second when the first one didn't work? Well, my doctor said it would help. And so at number 6, he's telling you, yeah, and I had one guy come to me, he had 6 lower back surgeries, and then they wanted to remove his coccyx. I'm like, and you're gonna do that? Well, the doctor said this would be the answer. Whew. Wow. Ouch. So yes, this can definitely help you. How much is it? Well, it's $34.5, $700 to $800 per month on a lease. If you have poor credit, I mean, some doctors, they've been through a few divorces, a few houses, you know the story. We can help you. It doesn't matter. 6 months, no questions asked, money back guarantee. There's my email, drmlj83@gmail.com. So yeah, we use it, peripheral artery disease, small fiber neuropathy, cardiometabolic function, I just showed you that, autonomic nervous system, endothelial dysfunction. What codes? Everybody wants to know the codes, right? We go 93922. That's systemic nervous system one side, and then 93922XS, which is the second side. 95921 cardiovagal innervation, PNS, and then 95923 ANS function. I'll have those below. And like I said, the reimbursements of $400 to $500. We've got some clinics just in TM Flow alone. They're doing an extra $25,000 to $50,000 per month. So that's how they're making up for those decreased reimbursements, because you're getting squeezed. So reimbursements are going down, but your staff expects to be paid more, right? Yeah. This is the answer. It really is. And then adding other therapies you may want to look at down the road and just not use gabapentin and Lyrica. That's, again, your choice. I'm just telling you what we do in our office, what works for us. And we're very successful at it, and we have been. So, one last time, my email, if you're interested, you want to get on the phone, you got questions, drmlj83@gmail.com. How do I know you're going to honor that money back guarantee? Well, great question. I am a distributor for the Synexus Neogen system. I've sold about 300 of those. I had 6 returns. I can put you in touch with those doctors. So, again, one last one, drmlj83@gmail.com. I'm Dr. Michael Johnson. Thank you for taking the time to watch this. I look forward to talking to you in the future.